Are there any weaknesses in the way that information is currently transported through the NHS, which you might be able to confirm?
well, I mean the whole the reason, you know, the whole fact that we're having this conversation in 2008 is difficult to believe when you imagine, you know, sort of 5 or 6 years ago it was anticipated that all of this information would be transmitted electronically, and you know, it still surprises me that we have to do so much with paper. But the problem is that to move on from that, the system has got to be standardised and integrated. And integrating the system simply by putting links between one part of the service and another isn't enough, in that you have to also have changes in people's behaviour and an understanding that's common to all of how the system works and how we're going to use it. So one of the issues, for instance, is the use of email. We're able to communicate with you know, consultant colleagues at the hospital by email, and we can consult them about a patient if we want, but that communication isn't actually linked to the patient's record at either end. As far as I know, it's certainly not linked at the practice end. So imagine I have a question of a consultant colleague, or vice versa, about a patient that we're both dealing with. We could send emails, but that email, you know, at my end would need printing out and scanning into the patient's record, which is ridiculous. Or it could be cut and paste into the consultation record. I know some practices do that, but it doesn't end up there automatically, which...
it's not very efficient.
No, but if you imagine, the problem is that emails are often sent less formally than other communications, sometimes very informally, and sometimes there's a query just about some very small detail of an appointment, you know, or the transport arrangements for an appointment. And if we start linking all communications with the patient's record, then the patient's record might easily get gummed up with minor details that aren't actually directly related to clinical care. So some thought needs putting into how we formalise that arrangement in a way that everybody understands.
For example, if a level of importance or a coding system for the type of communication that was going on between a GP and a consultant at a hospital, for example, if you were able to, for example, if you were talking about the transportation, if you could code that as you sent the email, code it transport or whatever, and it was stored in a certain place in the client's file which you could access but which wasn't brought up as quickly, do you think that might provide?
Yeah, it would need to be relatively easy to sort of cordon off information like that from the more clinically important information about you know, the patient's actual treatment or follow-up. So we would need to redesign our software at both ends. At the moment, you know, if somebody sends us a letter about a patient with, you know, dear Dr. So-and-so regarding this patient, you know, whatever it is, that will end up in their record, and everybody understands that that is what will happen. It will end up getting scanned into their practice record. If somebody rings the practice and says, you know, from outpatients, and says, just to let you know that Mrs. So-and-so's transport has been arranged for her to come to the clinic next week, then that isn't going to end up in their general practice record, nor should it. And the problem is that email gives us the ability to communicate about issues on the whole spectrum of importance. So if we're going to start doing things with email, and you know, the time has come when we really ought to be doing, somebody's going to have to decide how that is managed to avoid everything just getting gummed up. If I order a blood test for a patient, the blood sample is taken at the practice, it's transported to the hospital, processed in the lab, and then the result of that blood test is transmitted electronically back into the patient's notes. And this is an example of the system working really well with a laboratory link from the hospital to the practice. And it means that for the majority of blood tests, they end up coded using a read code actually in the patient's records and can then be searched. So that's a huge advance from a system of a few years ago, certainly 10 years ago, where the report would be paper-based, which is not only wasteful because it uses paper, but it also means that if you scan the cholesterol results into the record, perhaps, get rid of the paper, but you've still got a record which isn't coded and can't be searched on, unless it is actually manually added to the record. And in the days before the laboratory links, this is what we used to have to do. We have to go through our lab reports as they came in, and we would highlight them and give them to administrative staff if we wanted that result to be coded in, which is very sort of time consuming.
How complicated is the process of transferring a patient from one practice to another, and what information will be transferred and how will it be transferred?
Well, I have to admit, I'm not sure quite how far on the system is, but GP to GP, which is the name given to the system of transferring notes from one practice to another when somebody moves, is part of the National Programme for IT's original vision, along with electronic prescribing and the Care Records Service. So these things are very much part of the current agenda to make this easier. But at the moment, I'm afraid it's still the case that when somebody registers with our practice, you have to wait for paper records. We'll have a computer printout on it of all the relevant codes, but it will still need to be manually transferred.
I suppose that'd be... Sorry.
Yeah, it will still have to be, an administrative person will still have to go through, or a clinical person will have to go through each record and decide which are the major post-medical history items that need to be established on our system.
You mentioned the possibility of electronic prescribing. I was just wondering if you could give me some more of your thoughts about that.
Well, I think we're very nearly there with that, I gather. But the idea behind it is to provide a paperless system. So, the current system where a patient has to put in a request to have a repeat prescription for something that they're already taking, what happens now is we generate, in response to that request, we generate a paper prescription which gets signed by a doctor, and the patient then picks up the prescription a day or two later, takes it to the chemist, and the chemist processes it and provides the medication. Well, that's an extremely wasteful process. So, particularly as we now have email, the electronic requests, the request for the prescription comes, for a lot of patients, comes in electronically now. People can email a request for a repeat prescription to our practice anyway. Not all practices, but they can at ours. So the system should work that a GP, of course, has got to validate the request, has got to decide that yes, it is appropriate for this person to have a repeat prescription. But that can be done without any paper. It can all be done on a screen, and it can then be transmitted to the pharmacy. There's also the issue of patients viewing their own records. I've been discussing this with colleagues in the last couple of days. Patients, have a right of access to see their records, but it's still usually a process that involves, a formal sort of process of certainly in our practice, if somebody wants to see their records, they're perfectly entitled to, but there's a process to go through. Whereas, it may soon be the case that patients can access their own records online. And there are one or two private practices that are doing this already. And there are a lot of potential advantages to that. But of course there are also pitfalls. For instance, patients might be pressurised to reveal that information to other family members or employers. And the fact that at the moment there's a bit of a barrier might be to some people's advantage.